Hello everyone, welcome back to our channel MedVeda, where you seek a new learning experience with me. Today we are diving into a fascinating topic in hematology, that is hereditary spherocytosis. If you are a medical student or just someone curious about genetic blood disorders, you are in the right place. Let's get started. But first let's quickly explore the hemolytic anemia. It is by destruction the red blood cell lifespan has decreased. What are common features of hemolytic anemia? First, elevated erythropoietin levels to compensate the RBC breakdown leads to erythropoiesis and reticulocytosis. Second, accumulation of hemoglobin degraded products such as bilirubin plays a crucial role in the development of gallstones and subsequent jaundice. Types of hemolysis, not of hemolytic anemia. Extravascular, navigating the reticuloendothelial system, and intravascular, confined within the vascular space. Causes of hemolytic anemia. First up, the culprits within RBC itself, named intrinsic factors such as sickle cell anemia, hereditary spherocytosis, were problem in the genes, G6PD deficiency due to enzyme defects. Now let's talk about the troublemakers from outside, named extrinsic factors such as malaria, hypersplenism can trigger hemolysis. Now let's zoom in on hereditary spherocytosis, a genetic gem in the world of hemolytic anemia. Hereditary spherocytosis is characterized by misshapen RBCs spherical instead of their usual flexible disc shape by defect in RBC membrane. Epidemiology. Hereditary spherocytosis is predominantly autosomal dominant. Some severe cases it is autosomal resident as well, and more common in certain populations with higher prevalence reported in those of Northern European descent. Pathophysiology. At the core of hereditary spherocytosis is our DNA. Mutations in specific genes, often those regulating RBC membrane proteins such as ankyrin, spectrin, band 4.2, band 3, most common of ankyrin. Loss of membrane due to decreased stability led decreased surface volume ratio as well and decreased deformity, then morph into spherocytes. Now enter the spleen. It's the superhero trying to clean house by getting rid of abnormal cells, but with abundance of cells, the spleen works overtime. Then what happens? Discuss more in next. Here the RBC lifespan decreased to 10 to 20 days from 120 days. Okay? Peripheral blood film. It's a snapshot of your blood, allowing us to examine individual blood cells under the microscope. First stop, spherocytes with black arrow pointed with a spherical shape, unlike the usual flexible disc shape. Now talk about anisocyte. It's like having a mix of large and small RBCs. Time for Howell-Jolly bodies, or tiny remnants of the cell nucleus that should have been kicked at during RBC maturation. But what does hereditary spherocytosis bring to the clinical table? First up, asymptotic splenomegaly, of most common in hereditary spherocytosis. As we discuss in pathophysiology, that spleen work over time trying to clear out of abnormal cells results in increased number of macrophages causing it to enlarge. The weight of spleen increases to 500 to 100 grams. Okay? Second, anemia. Anemia kicks in due to the premature distrust, leading to fatigue and paleness. The severity of anemia ranges from mild to severe. The most common is moderate anemia of 60 to 75%. Third, jaundice. Common clinical feature of hereditary spherocytosis. Extravascular hemolysis releases increase in bilirubin, causing that yellowing of the skin and eyes, mainly in neonates. How do we diagnose and tackle hereditary spherocytosis? Clinical evaluation of blood tests shows NORMOCYTIC anemia with spherocytosis, reticulocytosis, decreased hemoglobin, increased red blood cell distribution width, increased unconjugated bilirubin, and increased RBC osmotic fragility. Screening of osmotic fragility test. Osmotic fragility increase in hereditary spherocytosis. Osmotic fragility assessed by degree of hemolysis in hypotonic solution. It increase in solution of more than 0.5% of NaCl. Well, treatment. Primary treatment for hereditary spherocytosis involves managing symptom and complication. This include first folate supplementation. It to support RBC production. It's like giving the body an extra boost in producing healthy cells. Second, blood transfusion. In more severe cases of anemia, blood transfusions may be necessary. This helps maintain adequate hemoglobin levels and elevate symptoms. Third, splenectomy. In some situations, doctors may recommend splenectomy, which is the surgical removal of the spleen. The spleen tends to filter out those misshapen cells, and removing it can reduce hemolysis. However, this comes with considerations and potential risks. Post-splenectomy, individuals may need vaccinations and antibiotics to prevent certain infections, given the role of the spleen in the immune system. So there you have it, a quick journey through hemolytic anemia with a spotlight on hereditary spherocytosis. If you found this is intriguing as we did, hit that like button, subscribe for more medical insights, and keep rocking.